Hey, future RN, let's talk about something that I know gives a lot of people stress, those tricky cardiac and EKG questions on the NCLEX. If that's you, you are in exactly the right place. Today, we're going to break down the heart's anatomy, the blood flow, and that all-important electrical conduction pathway, step by step. Welcome to ClearPath NCLEX. And I totally get it. This topic, it can feel really intimidating, right? You see all those complex diagrams, the waveforms, and it's just so easy to feel overwhelmed. But I promise you, it is so much more straightforward than it looks. And that's exactly our goal today. We're going to master this thing together, one simple step at a time. The idea is that you can walk into your exam feeling way more confident and totally prepared. Seriously, you've absolutely got this.
Okay, so let's dive right in. Before we can even begin to talk about the electricity, we have to know the layout of the building it's running through, you know? So first things first, let's cover the absolute must-knows of heart anatomy.
So at its very core, the heart is just a brilliant double pump. I want you to think of it like two hearts working side by side. The right side, it's got one job: pump that deoxygenated blood to the lungs so it can pick up oxygen. And the left side's job? Well, it pumps all that fresh, oxygenated blood out to the rest of the body. So remember, right to lungs, left to body. It's really as simple as that.
All right, let's meet the key players in this whole operation. We've got 4 chambers. You have the right and left atria up top. They're the receiving rooms for the blood. And then you've got the powerful right and left ventricles on the bottom. They're the ones that do the heavy lifting and pump it out. Now, to make sure all that blood keeps moving in the right direction, there are 4 one-way valves. And finally, you have the major vessels, like the vena cava and the aorta, which are basically the main highways in and out of the heart.
Okay, so now that we know the basic layout, let's actually trace the path of blood as it moves through the heart. You'll see that understanding this flow gives you the perfect why behind the way the electrical system is set up. So here's the journey, step by step. First, that deoxygenated blood from the body comes into the right atrium. From there, it passes through the tricuspid valve and into the right ventricle. The right ventricle then gives it a big push through the pulmonary valve and sends it off to the lungs. After it gets all oxygenated, it comes back to the left atrium, flows through the mitral valve into that powerhouse left ventricle, and boom, it gets pumped through the aortic valve, into the aorta, and out to feed the entire body. See? It's a full circle. All right, now for the main event. This is the part the NCLEX absolutely loves to ask about. We're talking about the heart's electrical conduction pathway. This is the system that tells the heart muscle exactly when to pump. Okay, first, there's one really crucial term you've got to know, and that's depolarization. When you see this word, I want you to immediately think contract. That's it. Depolarization is just that electrical spark that makes the heart muscle squeeze and contract. Now, its opposite, repolarization, that means relaxing. But for what we're talking about today, conduction, depolarization is the action word. So this whole electrical sequence kicks off right here. This is the first and honestly the most important step, the sinoatrial node, or you'll just call it the SA node. Just think of it as the spark plug that starts the entire engine. The SA node is famously known as the heart's natural pacemaker, and you'll find it right in the upper wall of the right atrium. Its whole job is to fire off that initial electrical impulse. Now, in a healthy heart, it sets the pace at a nice, normal 60 to 100 beats per minute. This little spark then spreads all across both atria, causing them to depolarize, remember that means contract, and push all that blood down into the ventricles below. Okay, so from the SA node, that impulse travels down to our next stop, the atrioventricular node, or AV node. And if the SA node is the pacemaker, I want you to think of the AV node as the gatekeeper. Now, here's what's so cool and so important about the AV node. Its main job is to pause. Yep, it actually holds on to that electrical signal for just a tiny fraction of a second. So why does it do that? Well, this little delay is absolutely crucial. It gives the atria just enough time to finish squeezing all their blood down into the ventricles before the ventricles get the signal to contract. Without that pause, the pump would be super inefficient. Oh, and it's also a backup pacemaker. It can fire at about 40 to 60 beats per minute if the SA node ever decides to take a day off. So after that super important pause, the impulse continues its journey down what's called the bundle of His. You can think of this like an electrical highway running right through the septum. That's the muscular wall dividing the heart down the middle. This highway then splits into a right and a left bundle branch, with one heading off towards each ventricle. And now we're at the grand finale of the pathway. These bundle branches end in this incredible network of tiny, specialized fibers that spread all throughout the ventricle walls. And these are the Purkinje fibers. So the job of these Purkinje fibers is to deliver that electrical signal almost instantly to every single muscle cell in the ventricles. And what does that do? It causes this really powerful coordinated contraction that actually starts from the bottom and moves up. This creates a really efficient squeeze, pushing blood up and out to the lungs and the body. And just so you know, they're the final backup system with a pretty slow intrinsic rate of just 20 to 40 beats per minute.
Okay, you've officially seen the entire pathway. So what do you say we do a quick fire quiz to really help lock this information in? This is such a great way to practice active recall for your exam. I'll ask a few questions, you think of the answer, and then we'll go over it together.
Ready? Number 1. Which structure is known as the heart's primary pacemaker? Give it a little thought.
Did you get it? It's the SA, or sinoatrial node. That's the one that sets the normal pace for the heart, right between 60 and 100 beats per minute. Awesome job.
Okay, next up. Which structure acts as the gatekeeper by putting a little delay on that electrical impulse? And the answer is the AV, or atrioventricular node. Remember, that delay is so important because it lets the ventricles fill up with blood completely before they get the signal to contract. You're doing great. Wow, we've covered a lot of ground. So let's put it all together on one final summary slide. Seriously, think of this as your go-to conduction cheat sheet for your study notes. This is the absolute core of what you need to have down. So here it is. Let's say it one last time to really drill it in. The impulse starts at the SA node. That's our pacemaker. It travels to the AV node for that slight delay. Then it shoots down the bundle of His, splits into the bundle branches, and finally it spreads through the Purkinje fibers to contract the ventricles. You need to master this pathway. I'm telling you, it is the absolute foundation for understanding every single dysrhythmia question you'll see on the NCLEX.
Thank you so much for hanging out with me at ClearPath NCLEX. If this explainer helped clear things up for you, do me a favor and hit that like button. And definitely subscribe for more high-yield content that's designed to help you pass on the first try. Oh, and don't forget to hit that little bell so you never miss the next game-changing NCLEX tip. And hey, drop a comment below and let me know which part of the conduction system still confuses you the most. I promise I read every single one. You are doing amazing. Keep studying. You have totally got this. I'll see you in the next one.